Thank you, Ben. Hello. It's hard to believe that just a few hours ago, Sheila E. was on this stage. Thank you so much for the introduction, and thank you for sticking around. I know being the last speaker on a two-day conference on a Friday afternoon, the fact that there's so many of you here, I'm really flattered. So thank you so much. And congratulations to CPCA on your 20-year anniversary. I don't think that there are too many conferences that I've been to where you start off the day talking about payment reform and all of the issues dealing with healthcare, and you end the night boogieing with Sheila E. So it's clear that you also have a multi-talented CEO. She can sing, she can dance, she can lead, and she can advocate. I've heard of, before I took this job, I heard of Carmela, but I really know her really through her mother and her father. In my past life at Rockefeller Philanthropy Advisors, Carmen and Al and I did a little mischief in trying to raise awareness about the contributions of philanthropists of color. And Carmen has flown all over the country. She participated in a video that I produced to really try to remind folks that it's just not the Rockefellers and the Fords and the Gates, that folks of color, women, the LGBT community also give. So, Carmela, clearly you are the daughter of Carmen and Al, but it's great also, Carmen, that you're here. Who would have thought that our paths would have found us here? And with no disrespect to you, Carmela, I do think I have one of the best jobs in California. I really do. And so, I'm in that weird sort of situation, the 6 months where I have to ask a lot of questions. The staff at the foundation have stopped me more than once for going into the men's bathroom. I have to ask a lot of questions, and as someone who's a control freak, it's a little uncomfortable. But so it's very clear that many of you probably know more about the legacy and the network of grantees of that Cal Wellness is funded than I do at this point. But I'm really been reading a lot, and I've really thought a lot and read a lot about the history. And the one thing that's really clear is that community clinics and health centers, they've been a really important part of the legacy of Cal Wellness. And I can assure you they will continue to be under my tenure. So I'm learning a lot, but as many of us, I wear different hats. So community clinics and health centers have been an important part of my family life. And it continues even after the office, that hearing about the work and the challenges of community clinics, it's usually the last thing I hear about at night and the first thing I hear about in the morning. You may know that my life partner of almost 40 years, Roger Peaks, not Roger Belk, he gets a little grumpy if you call him Roger Belk, is the chief medical officer at Valley Community Health Care in North Hollywood. He's really, in watching him over the years, he's really helped deepen my understanding of the challenges and the important work. Roger and I first met when we were 19 in college. He was at Northwestern, where he was in a very weird new area, biomedical engineer. We're of the age that you could tell all of the tech weenies by slide rules on there. And I was in the School of Communication, equally weird. I would, go around campus, writing poetry and humming. And somehow we found our way together, and although had different interests, the one interest that we immediately bonded over is the issue about service. Raj was pretty clear that he had decided, even as a sophomore, that he hoped to go to medical school and dedicate his life to serving the underserved. I knew I wanted to serve, but it didn't quite know how and when. So it's rather remarkable that we find our lives kind of intersected here. Raj is also responsible for me having one of my most embarrassing moments at a community clinic. CA isn't the only healthcare entity that knows how to boogie. The Valley Community Healthcare, their young staff throws a party every year. And last year, Raj told me the date and said the holiday party was going to be a costume party. And I'm thinking, oh yeah, right, okay. I said, okay, you handle the costumes. I was traveling. I came home on a Friday night, and the costumes, Raj is a big Star Wars fan. So there was a Darth Vader and a Princess Leia costume. And I sort of had imagined more of a Tina Turner outfit or something to that effect. And I said, okay, but when I told him it was his responsibility. And so we went, and Raj wanted to be a little late because he wanted to make an entrance. So before we walked in, he put on the Darth Vader mask. He couldn't see anything. And as soon as we walked in, I realized it was not a costume party. And Raj kept saying, what are they saying? What are they saying? And I'm saying, you are in real deep doo-doo here. It was a Venetian masquerade party. And everyone was dressed in elegant black dresses with the Venetian masks. And I was like Princess Leia with the braids. And so, it just was there. And we had made an entrance. And then finally, Paula Wilson Valley's, amazing CEO and new board member came over to me in her elegant black dress and just handed me a drink and said, I think you need this more than I do. It was a humbling experience, and it only got worse. 6 months later, when I was appointed to this new position, Raj said, they put a picture of you in the Princess Leia costume on the staff bulletin board with the note, our Princess Leia has a new job. So if you find me getting too full of myself, just send me an email and says, Princess Leia, knock it off. This has been a really, really exciting week for those of us at Cal Wellness. It is my first official public speech after us announcing our new Advancing Wellness program. And I can't think of a better venue to be talking to you about our new structure, because there are many nonprofits that are quite excited, nervous, a little interested in what we're doing. But I can tell you that if there's any organization that I would want to be heading, when you look at our new Advancing Wellness, it would be heading up a consortia health clinic, health center, because you will see many doors, I hope, where you can be partners with us. And I hope that if you haven't, you will look at our website. Just this week, we had 2 webinars with over 1,000 folks. We are taking the show on the road. We have Meet the Grant Makers meeting scheduled from Shasta, where I will be, all the way to San Diego. So I hope you will look at our website, you will come out and greet us, and be as excited as I am. One of the things that you will note in looking at our new guidelines will be that it is all based on social determinants of health. And as you know, because you know this work, it's just a fancy way of saying where people live, where people work, their race, and their income can impact their health and wellness. And today I want to focus on 2 of those aspects of social determinants. I want to talk about place, and I want to talk about race. Let's start with place. And I've said this over and over again, if I was running a nonprofit organization, the place that I would want to be would be in California. Whether it's true or not, and I worked with donors and foundations from around the world, there is a sense out there certainly in the philanthropic community, and I'm really talking about not only staff foundations, but individual donors, that the most interesting, the most innovative, and some of the best leaders are here in California. If you haven't, I would encourage you to read a new report that has just come out by the California Association of Nonprofits called Causes Count: The Economic Power of California's Nonprofit Sector. Nonprofits are the 4th largest industry by employment. Nearly 1 million people are employed by nonprofits. And of all of the 100,000 nonprofits in the state, about 30,000, or 24%, are health and human services. So I would suggest you, and I know you are using your power, but not only using the power that you have within this sector, the healthcare sector, but also I encourage you to join with other nonprofits. The other reason, the other positive reason, is that Place Matters is that California can count on significant foundation resources committed to the health of the underserved. When I started out on this journey in philanthropy over 25 years ago, it was a big deal when a foundation's assets hit $1 million. And we would all go, to the East Coast and pay homage to the Rockefellers and the Carnegies and the Ford. That has changed. The westward flow of wealth has made a major statement also with foundations. We have over 11 or 12 foundations with assets over $1 billion, and there is even significantly more resources available in an area that I hope you will continue also to hold accountable in terms of individual and family foundations. And many of them, and you know many of them, and you acknowledge many of us, are focused on health care, not only from Sierra Foundation, the California Endowment, Blue Shield, and others. The other reason why Place Matters for your work is we have a strong partner in state government. And that has been important as we have provided opportunities for so many through the Affordable Care Act. And we also have a supportive voter base. Just a few months ago, I was across the street in the state capitol sharing the results of our 8th annual Cal Wellness Field poll. And it was encouraging news. It showed thumbs up from registered voters on the rollout of the Affordable Care Act in California. And it's a tough group. I mean, they gave thumbs down to the federal government in terms of the implementation. They were moving in the right direction for the registered voters to understand that health care should be and is a human right regardless of your immigration status. So place matters, and it matters in, and you know this, and it matters in really personal ways. California is my adopted home. I grew up, and I'm a native of Virginia, on the other side of the country. I grew up, I was born in a colored, segregated ward in Alexandria Hospital, about 10 miles from the White House. I was the second of 6 kids. By the time my mother had the 5th child, she said enough. She was not pleased with the service and how she was treated at the Alexandria Hospital, which was very segregated at the time. And place mattered so much to her that she said, I am going to travel over the bridge to Washington, D.C., to Freeman's Hospital at Howard University, where I think I will be treated better. Place matters. Place also, and although there's been really a lot of changes in Virginia, Alexandria was not the tourist destination that it is now. Place matters for many folks in the state of Virginia, including my family members, who do not and cannot benefit from the full possibilities of the Affordable Care Act because Virginia has decided not to extend Medicaid. So place does matter. We in California know that as great as the state is, that there are many inequities. We are a foundation, and we will continue to be a foundation with a statewide footprint. We will fund organizations working in underserved communities throughout the state. Now, saying that, we know that there needs to be some work done on the foundation side. We know that foundation resources are not allocated equally across the state, and we need to work on that. Part of it is we just need to do a better job on our side. The other issue is that sometimes the highest need areas don't often have the capacity that's needed, and we hope to be working on that area too. And we will continue looking at promoting healthy and safe neighborhoods. We know that there's an intentionality to where you're located. You're located in communities where you can be close to serving the most underserved. So in addition to you being partners with us and us providing funding support to you, I want you to think of yourselves as philanthropic advisors, that you will be also telling us about other organizations that are working in the areas that we care about that we should be funding. So please think about a broader mission than your area. Think about the neighborhoods, and we want to hear your ideas. Next, I'm going to talk about race. And I know it's a little dicey for a Black woman to be standing up talking about race. I can feel the room, just easing a little, but I'm going to give it a try. I believe, first of all, that diversity is an asset. It's good for our state. I mean, it's the thing I really, really love about this state, about the diversity. I don't know about you, but my job does involve me often walking into rooms where still I'm the only, person of color, I'm the only woman. I'm much more comfortable, obviously, and I think I do my best work when I'm around a diverse team of folks. We think at Cal Wellness, the diversity of our board is really key. I want to recognize Isabel Pacero, who many of you know, who's my boss. She's not only an accomplished leader in the field, she also has great taste in CEOs, so thank you. But you know that the impact of race is not always positive. And I thought I would kind of just share with you wearing kind of another hat that I have, and that's a hat of a mother of an African American son. My kids are young adults out in the world, but I remember when my son Ryan, who's now 27, was born, I wanted for him as much as any mother would want. And as you know, you've heard about the helicopter mother. Well, I was like a jet fighter mother, wanting to have the best. And racism, even for folks of color, really sometimes does weird things to you. Number one, it can make you paranoid. When Ryan started school, it was a tough decision for us. He ended up going to a school that didn't have as much diversity as we wanted. And the school had, one of those cultural international days where the kids would pick a country of their choice. They're to come in costumes. You'd bring a dish, potluck dish in to represent the culture. Well, when I got the notice that Ryan's school was having an international day, I could see him in a dashiki. I, was looking through African cookbooks. And then I thought I probably should ask this kid, like, what country, Ryan, thinking, which African country? And he said, Canada. I said, Canada? And then he just ran off. And then I panicked. I got in a fight with Roger. It was your decision to put him in this school, not mine. Stayed up all night. And then I read another parenting book, and it said, if you ever want to know what your kid really is thinking, ask your kid. So, I was very nervous, and so I said, Ryan, could you just tell Mommy and Daddy why you picked Canada? And he looked at us like we were really stupid and said, Mom, you know how much I love Canadian bacon. And I told Miss Blackford that you're going to bring a big platter of Canadian bacon for the potluck. And needless to say, there was a message on my voicemail from Miss Blackford who said, Miss Belk, you know how much we love Ryan and you know how excited he is about Canada. We got the food covered. Bring paper products, And then when Ryan was about 12 or 13, we were living in Oakland, and I was working in San Francisco, and Ryan really wanted to say he was independent enough to take Bart into San Francisco. He had tried it once and it worked well, but he wanted to try it again. And again, I'm saying, listen, you got to call me as soon as you get to the station. Call me when you're on the train. Call me when you're off. Call me. And don't talk to strangers. And then he said something which proves that, racism can kind of break your heart. He said, Mom, I don't think anybody's going to bother me. I think people are a little scared of me. And, I'm hyperventilating and saying, well, why? And he said, well, I just noticed, when I get on, and he was, probably about almost 6 feet at this time, came out of the womb wearing a hoodie. And he said, I just think, sometimes when I sit next to especially, white women and white folks, I think I make them nervous. And I'm like hyperventilating, kind of thinking, I just thought I had just a little bit more time before I would have to really help this kid understand about the narrative of young black men. And then Ryan, seeing the pain on my face, said, Mom, don't worry, I figured it out. And I said, what did you figure it out? He says, well, I figured if I take a book out and I start reading it, people really seem to be okay with that. They calmed down. There was even this really nice woman who even asked me about the book that I was reading. He had kind of figured out what he needed to do as a young black man to make people feel safe around him. A kid that, wouldn't hurt a fly, had already understood how the world was seeing him. So racism can break your heart. And racism finally can make you angry. Ryan went on to college, went to grad school in North Carolina. Raj took him to North Carolina to help him move in. They rented an SUV to do some moving, out-of-state license. And when Raj called, he said, we were stopped by cops the first night we were in town. And Raj saying, in a way, I'm glad I was with Ryan, because Ryan was angry, and really helping him understand as a young African-American man what he needed to do, again, to stay safe in that situation. I was visiting with friends in Virginia, talking to my brother and brother-in-laws and saying, I can't believe it. And they looked at me saying, come on, Judy, every black man who drives through that part of North Carolina knows you got to have your papers together, hands on the wheel, because if you have out-of-state license, you're going to be stopped. And I'm saying, well, that's not right. Doesn't it make you angry? And my brother, half kidding, but not so half kidding, said, it's tough, sis, being a black man in America. So, just sharing with you those stories, I think you can understand why Cal Wellness, along with Sierra Foundation, the California Foundation Endowment, has decided that we really want to change the narrative. We will be investing more money than we have. We already are one of the top 20, but really trying to put more money in changing the narrative and looking at issues about education, incarceration, and other issues around boys of color. We're going to try to break the pipeline. The other personal issue about race, and it was kind of my first personal connection with social determinants of health. I hadn't even heard of that phrase. It was about 35 years ago. I had my first management job, was working for the city of Sunnyvale. They made every manager go through a major physical, and they put all of the statistics and they put them in a machine, and then they met with you. Usually it was someone who was a data person, not a doctor, talking about your health and wellness. And when I got my information back on a piece, at the top, when they said likely cause of death, they said homicide. And I was like, 26, and I'm thinking, yeah, right. And I just said, is there anything I need to know? And the seditious says, we just follow the facts. You're healthy, you know, you're black. It's like, you know, the stats would just say that if you were going to die, it's likely homicide, but don't worry about it. And I didn't worry about it, but unfortunately, it was an unfortunate and tragic predictor that really did impact my family. 6 months later, we lost Kay, who's here, my sister, and I lost my oldest sister, Vicky, to gun violence. She was healthy, college graduate, left behind a young son, and it was an issue that not only traumatized our family, but the entire African American community in Alexandria. And so race matters. Cal Wellness is the largest funder of gun violence prevention in the state. Too many lives are lost, and under my leadership, it will continue to address this issue with your support. We also will be looking at an issue that has been near and dear to my heart. At Levi Strauss, during the 10 years I was there, the Levi Strauss Foundation was the largest corporate funder of the fight against AIDS. And I am just, on one hand, encouraged and pleased at the progress we've made, but also heartbroken at how the face of AIDS has changed, especially how it impacts women of color, especially Black women. And that's an area that we will also be addressing. So, those are just a couple of issues that we will continue, hopefully, be able to look to you to be partners with. And I thought that I would end by just focusing quickly on 5 issues that I'm hoping we can zero even more on. And these are all areas that I know you're working on. One is storytelling. I think it's really important that you tell your story and you help others tell theirs. I often, throughout my career, I often feel like I do my job and I bring donors to nonprofits, and often the stories are not told. And if you ever meet with me, you know one of the first things I'm going to ask you is tell me a little bit about your story. Because this is a secret that you may or may not be aware of, but I believe good funders, good grant makers fund people, not organizations. So I want to know who's running the organizations. Why is it that in a room full of folks where you guys could be doing anything in any sector, you have chosen to dedicate your life to this work? Tell your story. I'm a private person, believe it or not, but I have a platform, so if telling my story will help people understand that, that would be great. Yesterday, I met with Darrell Steinberg. As you know, he's about to leave his position in the Senate, and as you know, he's been a major, major supporter of mental health issues. But what was interesting as he was telling me all about the statistics and Prop 63, all the amazing things that he's really done in mental health, what I was drawn to, because on the plane up, I had read about his daughter's own recovery and challenges and his family in helping his daughter deal with her mental illness. So I wanted to know about that because it made it real and it made it interesting to me. It wasn't a statistic. So tell your story. You know, continue to look at innovative ways to reach out to folks. You know, I don't know, put a little Sheila E. in your work. I recall that in the early days at Levi Strauss, we were making grants around the world in the fight against AIDS, and I brought together a group of our grantees in Western Europe who were saying they were really having a tough time really reaching young people to talk about safe sex. And they said to us, which is true, I mean, you guys know how to reach young people, and folks really think highly of your product. Is there a way that we can tap into your knowledge and your marketing? So I brought some of our marketing folks together, and together we created a public service announcement that ran through all of the movie theaters throughout Europe with the tagline, "Condoms, what to wear when you're not wearing Levi's." It was effective. The nonprofits said there was an increase in purchase of condoms in the stores afterwards, and it was a creative way to get the message out. Number two, or number three, I think, or number two, not sure which one I'm on, don't forget about public policy. And I know you know this, but if you put all of the billions of philanthropic dollars together, it pales to the resources that the government has at its disposal to enhance the wellness and lives of folks you want to serve. I often, when I'm talking to nonprofits and I'm talking to donors, I would say, where do you think nonprofits get most of their revenues? Most donors would say, oh, from philanthropy. I've been surprised that even some nonprofit leaders have said philanthropy. And you know that most of the revenues from nonprofits come from government. Second is earned income, which means you guys are being creative to try to find ways on your own to cover the gaps. Philanthropy is third. We only have to look at what the impact of ACA has had on this issue, and as you know, we still have work to done to show how important public policy is. The other issue is accountability. We all will need to do our work better, strive for excellence. You've already started this with your California Health Plus campaign to raise awareness about the quality of care and the range of services. We're also thinking about accountability at Cal Wellness. We're focusing on a number of customer service efforts in our work. It's taking us way too long to get money out the door. We hope to improve that, to look at our own systems. We're only going to ask for reports and information that we need. We are going to be maintaining our commitment to general operating support because, thank you. And we're going to save lots of trees by not having you submit paper applications. When we launched Advancing Wellness, we also launched our online application fee. So we need to continue, and we need to continue to say what we do, we're the best at it. Personally, I also think that you guys are the best kept secret in the nonprofit world. I know that when you're in a room like this, when everyone knows everyone, it's hard to believe, but I'm thinking about the world that I was in for 11 years, working with individual donors who often said, what should I support and what should I do? And them knowing very little about the amazing work that you're doing. And this is the other issue of why we need to really think about how do we reach these new donors, is the growth in philanthropy is not with California Wellness, it's not with TCE. The growth is really with family foundations and individual donors. And, which is why Carmen and I worked so well, we think that most nonprofits have also missed the boat in not tapping into, not reaching to communities of color, philanthropy, to LGBT communities, and others. So you need to tell your story and tell it in a different way, because sitting across the table with an individual donor, you got to tell your story in a very different way than a program officer at Cal Wellness. And these are people that really want your story. I can't tell you the number of times that I brought donors in and they've left and said, I just didn't get a sense of who they were. I mean, I heard about the statistics and the PowerPoint, but I didn't know who the person is. So always start with saying why you're doing this. And then finally, the thing I've been thinking a lot about, and this is where I want you guys to hold me accountable, I've been thinking about courage. I'm trying to kind of think, if there is any place or any organization that should be courageous, shouldn't it be a foundation? I don't have shareholders. I'm sitting on $1 billion almost in assets. All I have to do every day is supposedly get resources out to the community so you can do your job. So why is it that, for the most part, I think, and I would include myself, is that why is it that we're not more risk-taking? Why aren't we using our voices more? Why aren't we taking more risks? Why? And I think also about the times when I've been the most scared. And I look back, and I think in many ways it was kind of some of the best decisions I made. Early in my career at Levi Strauss, we made a decision. It wasn't a fight we went looking for. It came to us. We made the decision to discontinue funding of the Boy Scouts because of their policies around sexual orientation. I tried my best to negotiate with the Boy Scouts, and they had their values. They were not breaking any laws. Boy Scouts, private club, they can discriminate. And with the support of our board, we made the decision to discontinue funding. It was the first time in my career that every disaster planning effort that we thought of actually happened, including at the time Senator Jesse Helms going on the floor of the Senate saying that Levi Strauss was un-American and that he was putting a bill forward to make sure that our products would not be sold on any U.S. base. And I remember business leaders from the company coming in to me, in the foundation and saying, I thought people were supposed to like us, Judy, when we're giving money away. Why are we doing this? And the only thing I could say at the time was values. But I was scared. I mean, I came home a lot saying, I think I'm going to get fired, Raj. And we held together. We made and there wasn't a lot of support from the foundation at that point. I got a lot of calls saying, Judy, you guys are doing the right thing. Well, will you join us? No. And so I was trying to think, what made that work? And I think it was certainly the Haas family, a belief that, we had stated that we were a foundation that would not provide funds to organizations that discriminated on sexual orientation, and the support of, the board. But it was a scary time. I look back over that now, and it was probably one of the best decisions that I made in my career. And so I would just say, hold us accountable. We don't always have the best ideas. If we asked you to, merge with another health clinic, push back and say, why don't you merge with TCE, Judy? we don't have the best ideas. You have the best ideas. That's why we rely on you. But I do believe that I get courage by seeing courage in action. And I'm just wondering if we can all be a little bit more courageous, that we might together do what I think we all want to do, is really enhance the health care and wellness of this state. I want to thank you for your time. I want to thank you for your work. I want to congratulate you. And of course, may the force be with you.